back to drjimbyers.com. What I thought I'd show you today is what's called a neck adjustment or a cervical manipulation. I know there's been some concern from some patients that come in here, and actually chiropractors bring a tremendous amount of relief, especially for lower neck pain, upper neck pain, and headaches. And I just want to explain to you how this actually works with the patient laying down. As you can tell, one of the misconceptions that are out there is chiropractors cause more neck pain or can cause a stroke having an adjustment. As you can tell by the anatomy, the cervical vertebrae has a cervical artery. It only goes down to about C4, C5 area. A lot of tension and also a lot of what people get adjusted are below this area. So it's very safe to do this manipulation. First and foremost, I want people to know that. The second thing, what I'm actually assessing is these small little joints, which are much like the joints you have in your finger. So I tell people, if you ever stoved your finger as a child or growing up or even playing baseball in the backyard with your kids, you know how that stoved up finger feels. It's the same kind of motion that applies in the neck there. So with Betsy, I'm first going to assess and find out where we're having issues with her in her neck, and then I'll do the appropriate adjustment. Once again, just much like the middle of the back and the lower back, I do an assessment first to feel what I'm looking for. If there's good motion in the neck, I don't adjust that part of the neck. I only adjust what I find. Another thing that I do in my practice is I do a lot of what's called PNF stretching. If a patient has a lot of muscle tension in the shoulders or in the middle of the spine, I'll do what's called a nice stretch to relax those muscles. I'm a huge believer in most joint issues are addressed with muscle and joint things. We need to stretch tight muscles and we need to strengthen weak ones. In Betsy's case, she's got a right lower. It's very tight. Once again, there's no pain to the patient whatsoever on this. Nice settle stretching. Previous to this, the patient would have had a massage, would have had ultrasound, muscle stem, or heat. So the muscles are already nice and relaxed before I go to the manipulation side. When I do the manipulation or the adjustment, I make a real specific contact, just as you would your finger, and I'll go through it. Once again, patients may hear something, may hear nothing at all. I'll go back and do my post-assessment. If you feel that it's cleaned out, it's moving more freely now, and I know that was a success. Once again, no pain to the patient. The patient should walk out feeling better than when they walked in. If you'd like further information on Byers Chiropractic, please go to my website, drjimbyers.com. We're located in Waynesville, 4353 East State Route 73, Waynesville, Ohio.